Coming up today, our final live episode of 2024, we check the pulse of the respiratory viral season. Plus, life after long COVID, an update from a long hauler years after his symptoms started. Hey, good morning. I'm Dr. Steve Stites, filling in for Jessica Lovell this morning. Welcome to the Morning Medical Update. As we head into the holidays, we've gathered some of our experts to assess how the respiratory viral season is going so far. Specifically, we're talking about influenza, COVID-19, and RSV. But we're keeping an eye on bird flu, too, kind of like the state of California is really doing. Joining me at the desk is Doc Hawk, just like old times, brother, right there.
Yeah.
I like it. And what I really like is that Christmas sweater. I almost wore my cool one, but I kind of went my Chiefs look. But Bruce Springsteen, born in the USA.
There we go.
Not bad. All right, connecting via webcam are my colleagues leading parts of the University of Kansas Health System. Dr. Kelly Rhodes-Stark is a radiation oncologist and the chief medical officer at the Southwest Kansas City Market, which is to say, Olathe. And Dr. Raghu Adiga is still an infectious disease specialist, although I give him a hard time about that, because he's also the chief executive officer of the health system's Liberty Market. It is great to have you both on today. Finally, we have a special guest, Anil Garmarkar. Now, Anil, hopefully I got pretty close on that. Was that pretty good?
You got about 80% there.
I'm going to keep looking at it. Okay. It's been more than 2 years since we last spoke with Anil. But back during the height of the COVID pandemic, we talked with him quite a bit. I like to say the pandemic was like flying the plane while you're still building it. Or we always say, yeah, we're still building this plane as we fly it. Well, Anil was one of our co-pilots, helping us understand life as a COVID long hauler. Fortunately, the plane didn't crash, although maybe it had a few bumps here and there. Yes. Before we catch up, here's a look back at some of what Anil described on our previous shows. This morning we have a really special guest. Anil Garmarkar lives in rural Kansas around Parsons. He is a father of 9 and a COVID-19 survivor. He started getting sick April the 18th and was diagnosed with COVID-19. By April the 24th, he was hospitalized in Parsons, and by the 26th, he was life-flighted to the University of Kansas Health System, and he was a very sick man. Anil, tell us what happened.
I was delivering a load in Indiana, and I felt like I had allergies, and after the delivery, I just started to get really tired and really winded. And what would normally take me about a day to get back took me about 2.5 days to get home. My mom, even being a nurse, she wasn't wearing any PPE when she did the 20-minute drive to the hospital. So at some point in time, they had a pulmonary specialist that checked in on me on a tablet or a robot.
Yep.
And they had decided that they were at the end of their capabilities. And they had, they gave me an hour to talk to people before they were gonna put me on the ventilator. I mean, I knew the odds were not in my favor.
Anil is back with us today. If you'll remember, Anil had COVID-19, was here in the hospital, was here with us. He was here in the studio a few weeks ago with us. He's back in the hospital. Anil, how are you doing? Tell us a little bit about what brought you back into the hospital.
Well, actually, I was in Wichita, and my airway started closing again. And they recommended I transfer back to KU Med. After a week in ICU, they were able to bypass all the breathing issues and put a trach tube in, and I guess I got a speaking valve now, so I can actually get heard.
You've been out of the hospital several times trying to complete a recovery. What's happening now with you?
Last time I was here, they put a trach in because my airway had been closing for the last 3 months. So right now we were just recovering from that, and we're here today to try and do some steroid injections into the back of my vocal cords and hopefully avoid a larger procedure later.
How is your family handling this? Because you were really, I mean, this has been hard for you. You've had a lot of health problems from this.
Yeah, we've definitely closed in our bubble. It consists of just my wife and our two daughters. And we are doing the virtual school, and outside of that, anyone that comes into contact with us, everyone is masked up.
You've had that hard road, and talk to us a little bit about what is it like mentally and emotionally, the toll being a long hauler has taken on you and your family.
Honestly, I think it's been harder on my wife than it's been on me. Before the trach, we were in and out of the hospital almost every other day. My wife wouldn't sleep at night. She would stay up while I was sleeping because she was afraid I wouldn't wake her up if I stopped breathing. So she would wait till I was up to sleep. The last time on the way to the ICU, my wife was watching mile markers and where we were at from Wichita to Kansas City because she didn't think I'd make it all the way this time. Not where I want to be, but I'm so much better than a lot of people.
Anil, let's take that on. Is it painful when you talk?
It's not really pain, it's just more of a struggle. It's kind of surreal to be here today because 2 years and 2 days before we flew in. So it's much nicer to walk in than come in on a helicopter. Yeah. I heard later from my doctor at home that had monitored things. You know, she reminded me, you should feel grateful you're still here. I guess today, a year ago, my oxygen level was in the 60s. Wow. And my heart was failing, and my liver was having issues, and my kidney was attacked. And I think today would be the day my wife got a call from palliative care, and they were asking her how far they wanted to go to rescue me, to what condition I would be okay in coming back. So we remember these few weeks, you know, coming to KU, but we celebrate leaving on May 7th.
For us, that first 3 months was more of a fight to stay alive, and then the following year and a half was a fight to figure out what life was going to be afterwards. Swimming is obviously out, water sports are out. I'm not quite brave enough to go on a cruise.
And that last clip was from January 2022. Anil, where are you today?
No, I'm actually in my office, as the case would be, but we're getting ready to go on a cruise. So
yeah.
It's kind of a little ironic.
That's awesome. How's your family doing?
You know, we've kind of transitioned back to a little bit more toward normalcy. I know we put the kids back in school last year.
You've been living with that trach now for a few years, and I'm sorry.
Like they're a little behind. Well, no, I just said they got a little catch up being out of society, I guess, for a couple of years.
Yeah.
So they're responding pretty well.
That's good. Now I'm glad to hear your kids are getting to go back to school and have a little bit more of a normal thing. And that's got to feel good as a dad to watch that go on. Now, how's the trach getting along with you?
You know, I guess we've had it so long. I know my ENT doctor had said after a little while we'll be more used to taking care of it than most medical professionals. So I know we do a lot of our changes at home and do most of our maintenance at home. I think it's just kind of become part of stuff.
And how's your recovery going on a day-to-day basis? How are you feeling?
You know, I think I've found my new normal. As the case of being, we're kind of much more stable, I think, than where I was years ago. I know I'm talking to about switching to a button, something less invasive, and then probably when I get to retirement, I'll probably go through the surgery to fix it when talking's less required.
Yeah. Have you? Can you get out and get around and do the things you like to do? And how's that going?
You know, within reason. I can't, stairs, and I get too physical. I think it's not as much the trach, but I've got about half of my lung function left. So it limits, I'm not going to be running a marathon. I'm not going to be singing karaoke and not doing jumping jacks. But
are you still getting your COVID booster shots?
I hate to say it, but say no, we're not. This will be our second cruise. I think I've caught COVID 2 or 3 times since then.
Yeah.
And it just seems that it's been less and less of an effect as of late.
Okay. So, Dr. Adiga, how do you guys feel about that type of approach, gaining immunity through prior infection as opposed to vaccination? And what are your thoughts?
Well, I'll let the esteemed Dr. Adiga answer, and then I'll
He's the CEO. Does he know anything anymore? I don't know.
He's ID trained and boarded, so yeah, he still remains one of the brightest out there. That's
he is a good man.
Well, it works in most circumstances, I would say. But there is a difference, though. I mean, I think immunity that you get from the newer vaccines that have the more of circulating antigens in it probably will give you more protection against what's around rather than what you got from a previous infection from a previous strain. So there is some additional benefits to getting the immunity through not getting sick. That's my personal opinion. But, each person is different, and people who have gotten multiple strains experienced through infection may have developed certain amount of immunity. So that's my qualified answer.
Yeah, and I think we have to remember we are in a much different place as individuals seeing this virus now for 4 years and as a population or a community. So I think it is important, we do understand that our processes here in the United States are the most stringent probably around the world for allowing vaccines to come to market. So they look at safety and then they look at effectiveness. We know that these vaccines are extremely safe. I'm always going to be one to significantly endorse getting a vaccine. Getting a vaccine as the recommended, in the recommended schedule that we have our CDC and our ACIP committees recommending them. Because we know, just as Dr. Adiga said, it does help provide an extra immune boost, if you will, especially in that short term. But we know that certainly the data strongly support the fact that hybrid immunity, vaccination plus infection, is probably a little bit more superior to just the vaccine immunity. But now with everybody probably 85, 90, 95% or more people having had the infection in these past 4 years, most people probably have some sort of hybrid immunity. But I would still support the fact of getting the vaccine in the recommended, as it is recommended, again, to provide that boost immunity. And also we know that in the short term, you can have 3 or 4 weeks where your risk of even getting infected should you come into contact with the virus is reduced soon after that vaccination period.
Dr. Stark, your patients usually fall under the term immunocompromised in radiation oncology because you're talking about cancer. So how serious is the respiratory viral season for the folks you see?
It's very serious. And I have to say, Steve, I've been very concerned this year. I think that the further out we get from the pandemic, the more comfortable people become. They don't really remember the impact, particularly that COVID had, but certainly with flu. And the videos that we just saw are so impactful. So I strongly encourage my patients to get the COVID vaccine. It gives that extra boost of immunity. It's very important for my patients. It's important for the community as a whole.
So Dr. Adiga and Dr. Stark, what are you seeing at your hospitals right now in terms of the respiratory viral season with RSV, influenza, and COVID-19?
Yeah, here at Liberty, we have not quite seen the increase in COVID patients as we've seen in the state of Kansas, I guess. Currently, we are sitting at about 4 patients in the hospital. However, our outpatient testing, the laboratory testing shows that our flu numbers are going up actually within the last week. We've seen almost 8% test positivity for flu. That is certainly a jump up from 2 to 3% that we were seeing, mostly influenza A. RSV, we don't see a whole lot of pediatric patients here, so we don't see that much of inpatient RSV. COVID numbers have been hovering around test positivity anywhere between 8 to 10%. I think a week ago we had a little higher, 23%. But I'm concerned it will probably go up in the next 2-3 weeks.
Yeah, I think that's probably right. What are you seeing, Dr. Rhodes-Stark in Olathe?
So unfortunately, we are seeing quite an uptick. And so I think all of us nationwide, we saw that uptick in COVID in August and September. We had about 11% positivity of our tests, both inpatient and outpatient at that time. Then we saw the lull, and we would have 0 to 1 patients admitted at all times with COVID. Now, last week, we had 5 patients admitted with COVID. This week, 9. So our positivity, again, for inpatient, outpatient, we're back up to about 9.5%. I think that's going to continue to increase, particularly over the holidays. We've got gatherings, kids are out of school, we're going to be indoors. So I'm very concerned about that. Same thing with the flu. We had very low rates in early fall. It's really just been these last 2 weeks that we've seen an uptick. And this week we've had 7 admissions with flu. We've had just 1 admission per week with RSV.
Good. I know our numbers popped up a little bit too, Hawk.
Yeah, for sure. You know, we know that for a couple weeks there, we had single digits for COVID admissions. We were very happy with that, I think down to 4. I think this most recent updated data, which we obtained yesterday, I think we had like 14. So significant increase. Unfortunately, we've also had an increase of influenza as well. I was just prior to this, I went to get some coffee and ran into one of our hardworking hospitalists who was on overnight duty admitting patients. And he just off the cuff asked me if we had seen an increase in influenzas. And I said, yeah, a little bit. Why? He said like overnight, about half the people he admitted were positive for influenza A. So it's out there, and our numbers will probably be higher next week as well.
And we know the influenza vaccine doesn't have the effectiveness this year. I mean, still get it, but it's not as effective as some years.
But it will help still reduce the chance of going to the hospital, going to the emergency department, going to urgent care. So it does still have that benefit. But yeah, we know unfortunately that influenza vaccine is not always 100%. Not the highest efficacy, but it will help. It will reduce your chance of severe disease and having to go seek treatment as well.
All right, Anil, we're glad you're here to listen to some of the new research about the COVID vaccine and the long COVID risk reduction. For everyone who's listening in, be sure to ask your questions. Use the chat on YouTube or Facebook, or you can email the Medical News Network. That info is right now on your screen. All right. A recently published meta-analysis of 25 other studies shows that people who receive the COVID vaccine have a reduced risk of developing long COVID. This study showed 2 vaccine doses before a COVID infection was linked to a 24% reduced odds of developing long COVID. And I think, as Anil would probably tell you, that's something you clearly don't want, long COVID. The analysis suggests there is even some protective benefit to getting vaccinated after a COVID infection. Docs, when people consider getting COVID shots, should they think both about COVID and long COVID? Hawk?
Yeah, I would say so. We know COVID-19 can cause serious health problems, both acutely, as we've seen Anil had to deal with, and chronically as well. So we have to understand that. And I want to start with just the acute. We know that getting the vaccine, although some people were concerned, and there are some side effects, getting the vaccine and having the side effects from the vaccine is extremely and significantly less than getting the effects of the disease. You've always said that, Steve. And this includes things like cardiomyopathy. I know people have been concerned about maybe their younger adolescent sons getting the vaccine because there have been reports of the cardiomyopathy. But this is significantly less in both severity and numbers than people who actually get COVID-19, get the infection. So we have to say that, so we can have protection from the vaccine for that. The second part of that now, going on to the longer term complications, in any of the studies that have been done since the studies started coming out about long COVID, it has shown about a 15 to 30% reduction in the risk of getting long COVID. So I think that is one of the biggest points there. And certainly for younger people, especially those under 65, but even as we're talking about if you're trying to get your kids vaccinated, that was the main reason for me getting my children vaccinated at this point. It is to help reduce their chance of getting long COVID because they're young people. They're out being active, having fun, being with their friends. You want them to continue to do that. And if you can reduce their chance of having those long-term symptoms of the fatigue, the shortness of breath, any of those things that may occur, I think that's well worth it because for the most part, children are going to get less severe disease, but we know long COVID can happen even with very mild bouts of COVID-19 as well. So that was my biggest reason for wanting my children vaccinated.
Dr. Diga, thoughts from your standpoint about that?
No, yeah, I totally agree with Doc Hawk, and especially the important aspect, the last point that he made, even with the mild COVID, those patients having a long COVID is truly bothersome.
And Kelly, I would think that with the cancer patients, the challenge along COVID probably is greater.
It is, again, the immunity, the immunocompromised. And, we have so many side effects from a lot of our treatments that we impart in order to save people's lives. And so it's difficult sometimes to basically parse out what could be long COVID, what could be treatment related. But again, I think everything in life is a risk benefit, right? And so when we know that the benefits strongly outweigh the risk, then we need to make the logical decision to go with a vaccine, decrease our risk of severe illness, hospitalization, and death.
Yeah, those are a challenge, aren't they? So now, vaccine uptake last year is about 20%, so disappointing, honestly. But if we look at data from this year from the CDC, guys, it's the same number. These numbers are as of last Friday, December the 13th. 21% of adults have gotten the updated COVID vaccine. The rate is higher for those 65 and up, 44.5%. Flu vaccine is higher uptake than the COVID vaccine, in fact, 8% of adults, 40.8%, and 66.6% of people 65 and older.
Yeah, no, I think that's exactly right. It is unfortunate the vaccine uptake is so low. If we're talking about influenza, we know that even on those years where there is a bad match of the vaccine to the circulating strains, getting influenza vaccine can help reduce your risk of severe disease, hospitalization, from other outcomes as well, and even especially from any influenza infection. As far as the COVID vaccine, again, we have those short-term benefits of helping reduce your chance of infection in those first few weeks after vaccination. And then for the next few months, certainly reducing your risk of severe disease and hospitalization, and then long COVID. So if you can reduce your risk of long COVID, which is a huge issue for so many people in the United States, it is a quality of life issue, it is the ability to work issue. A recent study from JAMA Open Network showed that the incidence of long COVID has gone down since 2021 at 3.4% when those people were surveyed in 2023. So you say, well, that's 3.4%, but we're talking about Americans overall. So that is a large number, 5 million people or more. There was a more recent MMWR, which was published within the last 24 hours out of the CDC, showing in 2023, 6.4% of adult respondents had symptoms of long COVID. So that is a massive number. That affects people being able to take care of their kids, being able to work, being able to just do day-to-day activities. So it is vitally important, and we know vaccination can help reduce all of those things. So we certainly would like that vaccine uptake number to be much greater than it is.
I got vaccinated. I'm really glad I do, because when I had COVID last year, I'll tell you, I definitely had the fatigue for like 3 or 4 months, and I could tell it, and finally it eased off. Okay, a survey from the Pew Research Center found that the biggest reason for not getting the vaccine was that people didn't feel like they needed it. Guys, do people need the COVID shot even when they're young and healthy? Dr. Rhodes-Stark, let's start with you.
Absolutely. You know, again, risk benefit. Why do we have vaccines for all of these different illnesses, right? And I think that unfortunately with COVID, that there was just a lot of passion, and then out of that came a lot of rhetoric. So it's unfortunate that people have a negative connotation when they talk about COVID vaccine. It should be looked at as all of the winter respiratory illnesses. That's what we should look at it as. We should look at COVID vaccine, flu vaccine. We now have RSV vaccine for certain populations, and we're super excited about that for young children, of course. So young, healthy, older, immunocompromised, everyone, we should be getting our vaccines.
Yeah, 110%. I mean, these ideas about not having a polio vaccine, my answer to that is anyone who thinks that didn't ever see the post-polio patients. I mean, when I started in pulmonary disease back in the early 90s, I still had patients who had polio and now are in their 60s or whatever, and you can see the impact that had on their life. The idea that the polio vaccine hurts people is just, it's just so frustrating to hear that when you know the truth and you've witnessed the truth. So Kelly, I know you're going to have to run in just a minute. So Dr. Stark, final thoughts for today before you run?
I would just say, again, everything in life is a risk benefit, particularly in medicine. When we take medications, when we have procedures, when we take vaccines, just do your research. You can get online, go to reputable sites, CDC. The vaccine is safe. It is effective in preventing the severity of the illness, the hospitalization and death from COVID, also from flu. Please, please, please get your vaccines. Stay healthy. Stay out of the hospital. We don't want to see you here this winter. And I really appreciate the opportunity to be here this morning. Thank you.
Well, thank you for being here, and I agree with you. We don't want to see y'all here this winter because you didn't get vaccinated. Oh my gosh, that's not the right thing. Okay, I'm going to turn to Dr. Adiga for a moment. And when do you think people should get that COVID shot, especially if they've had COVID? How long should they wait?
Yeah, so typically the recommendation is to wait at least, close to 3 months or so after the initial infection and get your shot. And depends on your immunocompromised status as well. There is a recommendation that's been put out by the CDC for people to get the subsequent doses as well. There are certain immunocompromised people who may need 2 shots. That your physician will recommend that. So I would wait for 3 months after the recent COVID.
All right, and this is the recent recommendations up there on the screen. If you go to Dr. Adiga's point, wait 3 months, additional doses for 65 and older, and immunocompromised. You're supposed to get those a couple of times a year. Yeah, so I think we keep trying to emphasize this, how important it is to get the COVID vaccine, especially if you're over 65 and immunocompromised.
Yeah, and I think for that last point about the immunocompromised population, the CDC is using what they call shared clinical decision making. So you are able to get another dose of the vaccine as long as it's been 2 months since your last dose, but they want you to discuss that with your medical team and your physician for that extra dosing.
So Doc Hawk, bird flu is not as big of a threat thus far as flu, COVID, or RSV. But earlier this week, we did hear about the first American who was sent to the ICU for bird flu. Talk to us about what happened in Louisiana and what just happened in California.
Yeah, so as far as the Louisiana patient, again, this was a patient with a backyard poultry flock. Patient was older, over 65, and did have some comorbid conditions, but does have severe disease from H5N1 influenza. And what they were able to find is that this genotype, this certain virus, was from the avian lineage, essentially, not that lineage that had kind of jumped into cows, to dairy cows at this point. So they do have an exact source of exposure, which is the backyard poultry farm. But right now, no other updates other than that patient is in severe severe illness at this point in time. So, and as far as California, we are just continuing to see more and more cases. Specifically, they are also wondering about an exposure or an illness with no known exposure. I think we're still looking for that as well.
Let's go to Jessica Lovell. Gosh, sorry about that. Jessica Lovell in Studio B with some of the questions from our viewers. Jess?
It wouldn't be a morning with you and I if you aren't butchering my name or someone's.
That's just part of the story.
I know. I love it. Okay, first, Beverly loves your sweater, Hawk.
Yeah.
Bruce Springsteen.
The boss. That's
I know, right? Okay, Brenda says, thank you for recognizing that COVID is still with us. I fear people go around in their lives as if it doesn't exist. Jeremy has a question. Is it possible that CAR T-cell therapy can help us learn how to identify and target the COVID proteins and help us fight them, or does that mostly work for other things?
I don't know that CAR T therapy is going to work. Well, not CAR T therapy as it is constructed today will do it, because you actually have to develop the disease. We pull your cells out and kind of reprogram, give them back. So I don't know that CAR T has a role in this type of infection yet.
No, I think that is true. I think, for CAR T, and this is what you're alluding to, is developing the disease. These are more longer term disease. We know for COVID-19, it is an acute disease. Now, you do have long-term symptoms. We don't know the exact mechanism of that yet. There are several theories out there. But for the acute illness of COVID-19, again, I think that we are just going to be living with it. I don't think there's a role for CAR T at this point in time. It is an acute illness. You get the infection, you get over it, and then unfortunately, it is circulating around the world. So there is that chance that you're going to get reinfected in seveal months or a couple times a year.
It's an interesting question, because we're using CAR T therapy for a broadening array of diseases, but you have to really understand the basis of that disease or how you're going to treat it. I mean, CAR T, one of the things it does, one of the ways you can use it is to put a receptor that a therapeutic agent, you get a receptor to post on a cell, and then the drug you're going to give immediately can attack and then kill that cell. So, I mean, there are different ways to do it, but it's more of a cellular form of therapy, and I don't know that that's the answer right now in CAR T with long COVID yet.
Sean wants to know if there's going to ever be a flu-COVID shot combination.
Okay, Dr. Adiga.
I hope so, because there are some studies I hear that they're doing in looking at mRNA vaccines for influenza as well. So if there is some way to put those two together, that would be ideal. I mean, I would personally like to see the vaccine rates go up at least close to what the influenza vaccine rates are. It's almost twice as much. So, these days you can get both shots on the same day. And I wish people would do that, before the season. That would get the number back up. Yes, it's 2 shots, but hey, 1 visit.
I like the 1 visit. All right, Jess, one more question.
Yep, last question's from Joellen, and I really love this question. She says, my primary care doctor is very active in asking and checking on my vaccination status. She says, I'm 76, I've updated my flu, COVID, pneumonia, and this was her first time for RSV. She wants to know, how important still are primary physicians in this fight?
Oh, gosh.
Vitally important.
Because the front line is in the primary care physician's office. So the primary care docs have a much bigger role than, I'm a pulmonologist, I'm with 2 ID doctors, and I don't, we see people who are sick, and I will tell you, I have a chronic disease clinic with cystic fibrosis, and I'm always talking to them. Did you get your COVID vaccine? Did you get this? Did you get that? And, frankly, there's more resistance to vaccination now for COVID than there used to be. Most people still get their flu shot. But, but there's no question that whoever your primary physician is, who's treating you, the person you see the most often, the person you trust the most, that's the relationship that most matters. We knew that right through COVID. We know that today. All right, let's get through today's takeaways. So, Anil, what do you want people to know about your journey and about your future and about COVID-19?
Well, Jace, I was trying to think of something and I can't right now. Honestly, it's just to be my personal mantra has always been to look this time of year, to look at how the year went and look at how to improve next year. And, pick something, pick some metric and, just appreciate what you have and look to improve next year going forward.
I like that. Dr. Adiga.
These days you can get your medical information from so many different sources. My takeaway is that try to get that from credible sources. I think one of the most credible sources of information is your trusted physician. So please listen to them. And of course, there are other credible sources, but certainly not the social media.
For sure. Doc Hawk?
Yeah, I would like to piggyback on that. I think that's a very vital point that Dr. Adiga made. We treat patients. We evaluate them, treat them, but we also do something harder every day, and that is fight disinformation and misinformation. That is a 24-hour job, unfortunately, for public health officials, medical professionals, scientists at this point in time. So treating mis and disinformation is a major thing that we have to do. And if you are looking for outside resources, obviously the CDC is a great site. Your local state and county health department websites are good, as well as things like University of Kansas Health System website or any of the other broadly known medical institutions around the country. But what I would like to say is, in this final word for 2024 is that people are out of school now. They may be out of work. They'll be traveling to see friends and family over the holidays. Make sure you have a plan. What kind of plan? Make sure that you have a plan that if you have symptoms, that you, especially if you are high risk, talk with your physician, know what to do. So the first thing is testing. It is vitally important to test early. And if you're doing home testing, you may have to test often. We know that there are home tests that are available. This is a 3-in-1 actually, which tests for COVID as well as influenza A and influenza B. These are commercially available. I would recommend maybe buying a couple packs of those and taking with them if you are traveling, or have them in your house. That way you can then call your physician and hopefully get on the antiviral drugs to help reduce your chance of severe disease and hospitalization. The other thing is prevention. You can still get vaccinated for influenza and COVID-19 like we just talked about. If you're in the recommended age group, please get RSV vaccine. The first vaccine for RSV came out last year. If you received it last year, you should be good. There's no other recommendation other than just one shot at this point in time. And then, of course, those things that we always talk about. People are going to be traveling. So if you feel uneasy about a situation, it's always okay to wear a mask in a situation. It will help reduce your chance of infection. Know the situation and the environment around you. The other thing that Dr. Stites has always talked about is the main pillar of infection prevention is frequent and adequate hand hygiene with soap and water or alcohol hand sanitizer, especially if you're out in the airport or those high-flow community areas. If you can do that frequently and also avoid touching your hands to your eyes, your nose, your mouth, you are going to significantly reduce your chance of getting infected with any of these viruses on your travels or for your holiday season.
Our team here has said it best, and Anil, thanks again for being here on the program. Watch me take this swing at this to Anil Garmarkle. Yeah, I got it close. Yeah, at least 85% you said. Thanks for being back with us. It's a pleasure to see you, and I'm glad you're doing well. I'm glad you're doing well. I'm glad you get to go on a cruise. That's awesome. I come from a Christian tradition, and I love to celebrate the seasons of Advent. Hope, joy, peace, and love. Here's what I know. When we find those things, that's usually where we can find the truth. When you get caught up into the political rhetoric, and you start listening to folks with rabid viewpoints who don't really speak from a background in healthcare, talking to you about vaccination, you have to ask yourselves, how can they possibly know? How can they be telling me the truth? One of the things we've tried to do throughout the COVID pandemic and up until this moment is to always tell you the truth to the best of our ability. Because if we can find hope, joy, peace, and love, you know what we can also find? We can find the respect we need for each other to have an honest, real conversation, not from the shrill sound of politics, but from the honest feelings of a holiday season where we're trying to take care of each other. I hope you find the time to do that this holiday season. Remember, faith, hope, and science helps you live long and prosper. Starting next week, you'll see some encore presentations of the Morning Medical Update, open mics, and all things heart. Our next live program is in February, but if anything pressing comes up, we will bring you a live update. And until then, stay healthy as you enjoy the holidays.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.